all the benefits of exercise. So reducing the risk of depression, anxiety. It slows or reduces weight gain, weight loss, particularly combined with reduced calorie intake. So uh, losing weight is actually more of what you're eating as opposed to exercise, but it does contribute to increasing your metabolism. It improves bone health with physical function and improves sleep. It lowers your risk of falls, specifically with older individuals. It lowers your risk of fall-related injuries. So if you do fall, you have a little bit stronger structural system, your bones, to withstand the impact. It's been proven to lower your risk of all-cause mortality, meaning you can live longer when you're in healthier shape with exercise. Lowers your risk of cardiovascular disease, stroke, high blood pressure, diabetes, cholesterol. It actually lowers your risk of certain cancers, certain bladder cancer, breast, colon, endometrial, kidneys, lung, and stomach, to name a few. It helps improve your cognition. So there are new studies coming out showing that it actually can help with people with Alzheimer's and dementia. It helps lower the effects of those diseases, and then also can prolong the inception of those diseases throughout life. And then overall, it improves the quality of life of every individual. So the benefits of exercise are really staggering when specifically relating to your pulmonary system, and it helps to improve your ventilation by increasing what they call the tidal volume. That's your normal resting, breathing, inhalation, and exhalation. It lowers your respiratory, improving efficiency with each breath. So what I mean by that is you're able to get more oxygen in and CO2 out with each breath as you become better in shape. It improves your strength of your respiratory musculature, specifically the muscles in between your ribs and your diaphragm. It increases their perfusion of blood. So what that means is you have more oxygen and CO2 being moved into your bloodstream, and improves your what they call the alveoli, your part of your lungs that helps with gas exchange. It improves capillary refill, so more blood supply or increased arteries to your alveoli, so it helps with your efficiency. And also down to the cellular function improves as well with increase in hemoglobin and red blood cell production within your system. So all these things really help to improve your breathing by multi-system. So let's talk about some statistics. So in 2020, there was a good study coming out of the British Medical Journal. It looked at close to 500,000 people over the course of 9 years. So this is one of those optimal studies because it's a huge N, or a huge population of people for over the course of 9 years. So that hits all the check marks for a good study. They found with adults who exercise 150 minutes per week at a moderate or at least 75 minutes of vigorous activity has a lower incidence of death. The study also suggested a greater increase in survival for people that participated in aerobic and both strength training exercise, and actually lower the death rate for people with cardiovascular disease, cancer, and chronic lower respiratory tract disease. So a lot of people with respiratory disease say, well, I have a hard time walking across the room. How can I possibly exercise? I'm already, taxing my system by walking across the room. But there's specific ways of exercising that can help with this, and really finding the right type of exercise for you, getting your heart rate up in a easier manner with strength training and respiration does improve over the course of a couple weeks of doing it consistently. So that's why most people don't come to pulmonary rehab, because they're afraid that exercise will overtax their system. But in fact, it does just the opposite. It actually improves. So a lot of people don't know where to start. So what I say is, well, if you're going to do this at home, if you're going to be independent with this, simply start by just moving. So a lot of times just moving around, dancing, clapping, those are some good starts. A lot of people maybe have arthritis. They have some conditions where they're not very mobile. They can't get around that easily. And just by simple movement can get your heart rate up enough to actually initiate exercise. I love when people come in and say, well, I didn't exercise, but I was dancing for about 5, 10, 15 minutes to a couple songs I really liked. And I was like, that is perfect because it's a lot of fun and people enjoy doing that. And it doesn't seem like so rigorous of a routine.